Stay with me for a moment, because what I'm about to share could change the way you or someone you love approaches surgery forever. Imagine walking into an operating room expecting to come out physically better, only to find that something far more important feels altered afterward. Not your body, not the surgical site, but your mind, your memory, your sense of clarity. It doesn't happen to everyone, and it doesn't always get talked about, but when it does, families notice it immediately. A different look in the eyes, a hesitation in speech, a moment of confusion that wasn't there before. And here's the part that makes this so important. In many cases, it isn't the surgery itself that plays the biggest role. It's something almost no one asks about before the procedure begins. Most people, when they're told they need surgery, go into research mode. They look up the surgeon's experience. They read reviews. They ask about success rates, recovery timelines, and possible complications. They worry about pain, about scars, about how long it will take to get back on their feet. All of those concerns are completely valid. They're natural. They matter. But there's a gap in that preparation process, a quiet blind spot. Very few people stop and ask a different kind of question, one that doesn't focus on the surgeon or the incision, but on the brain. What actually happens to the brain during surgery? And more importantly, how is it being protected? This question becomes especially important as we age. The body changes over time in ways that are obvious: slower healing, reduced strength, longer recovery. But the brain changes too, and those changes are more subtle. They don't mean weakness or decline in intelligence. They reflect something called cognitive reserve. Think of cognitive reserve as the brain's resilience, its ability to absorb stress, adapt, and return to normal functioning after disruption. When we're younger, that reserve is strong. The brain can handle significant physiological changes and bounce back quickly. But as we grow older, that reserve gradually narrows. The margin for error becomes smaller. Now consider what happens during certain types of anesthesia, particularly the kind that renders a person fully unconscious. This isn't just sleep. It's a controlled, medically induced suppression of brain activity. Multiple drugs interact with receptors throughout the central nervous system, dampening communication between neurons. The brain is placed into a deeply altered state so the body can undergo surgery without awareness or pain. For many people, especially younger individuals, the brain recovers from this state without lasting effects. Within days, they feel like themselves again. But in older adults, the story can be different. The body processes medications more slowly with age. The liver and kidneys, which are responsible for breaking down and clearing drugs, may not work as efficiently as they once did. This means anesthetic agents can remain in the system longer, extending their effects on the brain. In the days following surgery, some patients experience something that families often describe as startling: confusion, disorientation, a sense that the person they know is not fully present. This condition is called post-operative delirium, and it typically appears within the first few days after surgery. It's not simply grogginess. It can involve vivid confusion, difficulty recognizing familiar faces, or an inability to understand where one is. Some patients become agitated while others withdraw completely. For families expecting a smooth recovery, this can be deeply unsettling. And while delirium can resolve, it doesn't always end there. In some cases, it's followed by a longer, lasting change in thinking and memory. Tasks that were once simple, managing finances, following conversations, remembering names, can become more difficult. The sharpness that defined a person's independence may feel dulled. Imagine someone who was completely independent before surgery, driving, handling their own affairs, enjoying conversations, and then slowly, quietly, things begin to shift. They pause more often when speaking. They forget small details. They seem less confident in situations that once felt effortless. These changes can be subtle at first, but over time, they can reshape daily life in ways no one anticipated when the surgery was first planned. This is where the conversation becomes more complex, because medicine is still working to fully understand why this happens. Researchers continue to study whether anesthesia directly causes these changes or whether it interacts with underlying processes already developing in the aging brain. But regardless of the exact mechanism, one pattern has been consistently observed: different approaches to anesthesia can lead to different cognitive outcomes. This is where awareness becomes powerful, because there are ways to perform many surgeries without placing the brain into a deeply suppressed state. These approaches don't eliminate all risks, and they're not suitable for every situation, but they open the door to a different kind of conversation, one that focuses not just on the success of the operation, but on preserving the person as they are. One such approach involves targeting specific nerves rather than the entire brain. Instead of shutting down awareness, it blocks pain signals at their source. The surgical area becomes completely numb, while the rest of the body and the mind remains largely unaffected. Patients may remain awake or lightly sedated, breathing on their own, able to respond if needed. The experience is calmer than many expect. There's no deep unconsciousness, no mechanical breathing support, and often a smoother recovery afterward. Another important advantage is that pain control often continues for hours after the procedure, reducing the need for strong medications that can themselves affect clarity and alertness. Another method focuses on the spine, delivering anesthesia in a way that affects only the lower part of the body. This can be particularly useful for procedures involving the hips, knees, or lower abdomen. The patient may rest comfortably, sometimes even lightly dozing, but the brain is not placed into a deeply suppressed state. Breathing remains natural. Awareness can be maintained at a gentle level. There are also techniques that use a thin catheter placed near the spinal cord to provide continuous pain relief during and after surgery. This allows for precise control over discomfort while minimizing the need for heavier medications. Patients often move sooner, breathe more easily, and recover with fewer complications related to pain or sedation. For smaller procedures, a combination of local anesthesia and light sedation can be enough. Patients remain relaxed, calm, and comfortable, often describing the experience as peaceful rather than overwhelming. They are not fully unconscious, and the transition back to normal awareness is typically much quicker. What's important to understand is not that one method is universally better than another, but that options often exist, and those options are not always discussed unless someone asks. Healthcare teams work within established routines. These routines are designed to be safe and efficient for large groups of patients. But no two individuals are exactly alike, especially when age, medical history, and personal priorities come into play. That's why a simple question can make such a difference. Not a confrontational question. Not one rooted in fear, but a thoughtful, informed question that invites discussion. Something along the lines of asking how the brain will be affected during the procedure, and whether there are ways to minimize that impact. This kind of question doesn't challenge expertise, it signals engagement. It shows that the patient is thinking not just about the immediate outcome, but about life after the operation. And that shift in perspective can change the entire tone of the conversation. Doctors, especially those experienced with older patients, understand these concerns. Many welcome the opportunity to tailor care more precisely when given the chance. But they may not always initiate the discussion themselves, simply because not every patient is aware that it's something to consider. So the responsibility often begins with awareness, understanding that surgery is not just a physical event, but a neurological one as well. Understanding that recovery is not only about healing tissues, but about preserving identity, memory, and independence. And understanding that small decisions made before entering the operating room can have lasting effects afterward. It also helps to recognize that when general anesthesia is necessary, and in some cases it truly is, there are still ways to approach it thoughtfully. Adjusting medication doses, closely monitoring brain activity, and carefully managing the recovery period can all play a role in supporting better outcomes. These are nuanced decisions, and they benefit from open communication between patient and medical team. If you imagine two different paths, a patient who undergoes surgery without ever discussing these considerations, and another who takes the time to explore options and ask questions, the difference isn't just medical, it's personal. One path relies entirely on default decisions, the other invites collaboration. Neither guarantees a perfect outcome. Medicine is never that simple. But one path ensures that the patient's priorities are part of the plan. And when those priorities include protecting the mind, that inclusion matters. So before any future procedure, whether it's for you or someone you care about, pause for a moment. Look beyond the surgeon's credentials and the technical details of the operation. Consider the brain. Consider how it will be affected, how it will recover, and how it can be supported. Write your questions down if you need to. Bring them into the consultation room. Give them a voice. Because in the end, the goal of surgery is not just to fix what's wrong, it's to help someone return to their life as fully as possible. And that life is shaped just as much by the clarity of the mind as it is by the strength of the body. Protecting that clarity begins before the surgery ever starts.